Hi, welcome to my podcast, Reclaim. I am your host, Thaís Sky. I have supported women navigate the complexities of being human for over 10 years. This podcast is where I disseminate some of those learnings and offer thoughts and guests to guide you into your healing. Welcome. Hello, dear listeners. Thaís Sky here. Welcome to Reclaim the podcast. I'm so excited to bring to you a new series that I'm doing here on Reclaim called Talk Therapy, How to Get the Help You Need. This is part 1 of this series. I believe it will be probably a 4 or 5 part series, but we'll see, where we're going to talk about mental health. We're going to talk about the nitty-gritty of how to get the help that you need. It's important to quickly name here that this podcast is not meant to replace actual help. If you are in crisis, please don't hesitate to contact the National Suicide Prevention Lifeline, 1-800-273-8255. That's 1-800-273-8255. Or, seek the care of a professional. This podcast, this episode is meant to educate. It is not meant to replace. So please take care of yourself as you're listening to this episode. I've decided to do this series now because May is Mental Health Awareness Month, and I've been wanting to record episodes on my thoughts of the world of mental health for a long time, but I haven't because it hasn't felt the right time. And then suddenly, the way life tends to go is it just felt like the right time. And so in this episode, I want to give you all a lay of the land. I want to share some of my thoughts of what is happening in the world of mental health. We're going to talk about professions that reside within the world of mental health. We're going to talk about the different types of support. But I'm going to infuse this episode with my own experiences, my own thoughts, my own perspectives on the world of mental health, because you can get this information anywhere, truly. I wanted to record this episode in this series not just to give you the straight up facts, but to also offer a way of looking at the world of mental health that may be supportive for you and your mental health. Because I think that in many ways, the ways that some people look at mental health is actually creating a bigger problem. And we'll get into that in a minute. But first, it's really important to name, one, who am I to be talking about this? Well, if you're new to the podcast, in March of 2018, I began my master's study in clinical psychology. I am about 6 months away from being done with my required 3,000 hours to apply for licensure. And I'm looking, hopefully by the end of the year, and if not early spring of next year, to be licensed as a marriage and family therapist in the state of California. So as a student of psychology, as someone who has been in the field for the past few years, as a intern and then as an associate, AMFT, Associate Marriage Family Therapist, I have a good idea of what's happening in the field. And before this, if you know nothing about me, I've been a coach since 2010. I still am a coach, and I coach women reclaim their worthiness wound, heal, and tend to this very tender place within them so they can rise up and take up the space that they want in the world. And so I've been holding and grappling and understanding human suffering for a long time. 2010 is 11 years ago, and really attempting to understand why humans are the way they are and how can we support each other. That's what took me into grad school, and now here I am. And so my biases are various. One, I'm based in California. In the country, in the U.S., each state has their own licensing procedures. They have their own licensing types. And this can get very complicated. If you live anywhere outside of California, it's not saying that this stuff isn't applicable to you, but some of the titles, some of the licensing names may be a little bit different, and that complicates things. Another bias that I have is, of course, that I operate within the United States, which means I can't really speak to the complexity of the world of mental health outside of the United States. That's not to say that this episode and this series won't be supportive for you. I still believe it will. However, you may need to do some additional research to understand how the mental health landscape is in your specific region, country, state, etc. Okay? So that's one really important thing that I want to put out at the onset. Okay. Another thing that I think is really important for us to name is I do have a goal for this series. And my goal is to celebrate the efficacy of talk therapy. Now, you may be thinking, that's a little bit of a weird goal. Obviously, talk therapy is important or is helpful. Or maybe you may be thinking, what the fuck is talk therapy? In the world of mental health, as you will soon find out, as I am sharing my own biases with you all, there is a strong position against talk therapy. And this makes me really sad. And so we're going to talk about research. We're going to talk about science. We're going to talk about how our industry, how this field is being shifted and shaped and morphed into a way of looking at mental health that actually denounces talk therapy, which is the only real thing that has been shown to stand against the test of time as the thing that helps the most. But I think that can get very lost when we're talking about psychotropic medication, when we're talking about these talk therapy apps where you can text a therapist, right? And when we're talking about healthcare and what gets covered by our health insurance, it can get very easy to lose sight of a really important grain that I want us to be thinking about, which is actually that talk therapy can be absolutely revolutionary. And so we're going to keep that in mind, okay? Now, you don't have to believe me yet. I'm hopefully going to build an argument over the next few modules, over the next few episodes, to support you in thinking if that's true for you. And maybe you'll leave this series and it won't change anything for how you view talk therapy or how you view mental health. Or maybe it will shift and change and help you understand a little bit more about why it can be so hard to get the help you need, and what you may be able to do to support yourself in getting the help you need. Because self-advocacy is the greatest thing that we have, and you deserve to get the help you need. Okay? So now that I've shared all of this, let's start by even just defining mental health. If you go to mentalhealth.org, they define mental health. It says mental health includes our emotional, psychological, and social well-being. Okay, that could mean a lot of things. The attempt here is to differentiate mental health from physical health, where physical health is how our body is responding to disease and illness and being healthy and vital. Mental health is seen in similar light, where it's how healthy we are emotionally, psychologically, and how well adapted we are socially. This already brings up a lot of questions. First off, who decides what is healthy? If you've been a part of this podcast, you know that I've really grappled with this word health. What does health mean? Who determines what markers of health are? Right now, physically, a lot of markers of health are defined by weight. If you are above a certain weight, you are considered unhealthy. But there are so many other markers that we could choose to define health. Why are we choosing weight as a defining marker? What if we could define health by how much our capitalistic system promotes this idea that rest is lazy? What if we were to define it in other ways, right? So when we think about health, we're thinking now about this idea of the medical model of looking at our well-being. The medical model promotes this idea that there is illness and there is health. And the medical industry, doctors and such, their purpose is to help our physical body combat an illness to be healthy. Okay, that sounds all fair and good. I guess we're supposed to want to be healthy. I guess that's what our culture says. So I guess that means that we're the attempt to eradicate illness. It makes a lot of sense. Okay, I guess I can wrap my mind around that. But then we have to ask ourselves, what is a mentally healthy person? If you have experienced significant trauma at the hands of somebody else that has affected your well-being, are you now considered sick, or is the other person considered sick? If we've learned to adapt in a way that our society decides is not adaptive, who is the sick one? Are you the sick one, or is society the sick one? Right? It's this idea of like teaching a fish to climb a tree. That doesn't make sense. But if we live in a society where there is a defined normal and everyone has to be within that range of what is considered normal, and if you're outside of that range of normal, you are now considered sick, then that becomes a problem. It becomes a problem because we're not looking at how the systems are contributing to the health. Can we truly be mentally healthy in a world that perpetuates this idea that we are not allowed to rest, as one of a million other examples? That rest means that we're procrastinators, that we're lazy, that we're not motivated. That if we're not working above and beyond for someone else's dime, then there's something wrong with us. How do we define mental health in a mentally unhealthy world? Right? So that's one question that I have just at the very onset of thinking about why we use the term mental health. If we use the term mental health, that means that we kind of can't help but think about mental health from the lens of a medical model that tells us that illness is to be eradicated. But I think that misses so much complexity about what is the difference between illness and personality. What is the difference between adapting and illness? And how can we use the medical model, or how does the medical model promote this idea that if we don't fall within the prescription of symptoms, disease, treatment, then we are considered uncurable? What is the cure? Let me use some other people's words to kind of help us frame this. There's an article on verywellmind.com, and the title is Medical Model Use in Psychology. And it says, a medical model is a set of procedures in which all doctors are trained. Psychiatrist R.D. Laing coined the term in The Politics of the Family and Other Essays in 1971. So I'm reading right from this article. It says, the medical model's school of thought is that mental disorders are believed to be the product of physiological factors. The medical model, which is more widely used by psychiatrists and psychologists, treat mental disorders as physical diseases, whereby medication is often used in treatment. And now, supporters of the medical model usually consider symptoms to be a telltale sign of an inner physical disorder. They believe that if symptoms are connected, it can be characterized as a syndrome. So in the medical model, if the brain is connected to the body, if there is an illness, if there is an unhealthy mind, then it must be connected to our physiology. This is not my words. And so if we can just understand the physiology, and if we can just correct the dopamine, serotonin levels of the brain, then we can eradicate that disorder or that disease. Back to the article. It says the biological approach of the medical model focus on genetics, neurotransmitters, neurophysiology, neuroanatomy, and so on. Psychopathology says that the disorders have an organic or physical cause. The approach suggests that mental conditions are related to the brain's physical structure and functioning. Okay, are we still here? If we're looking at mental health in terms of the medical model, then the only thing that matters is our specific neurophysiology, neuroanatomy, and so on. How our brain is working. If we have too much, serotonin is not adapted in the brain, etc., then we just need to fix that and the disease will go away. Okay? The challenging about medical model is that it misses a whole slew of way of looking at the human suffering and understanding what may be underneath, beyond the chemicals, beyond how the brain is functioning. There was a really interesting article that came out that NIH spent billions of dollars funding science research into the brain and how the brain works. And they spent billions of dollars, and after hundreds of studies, we are no closer to actually knowing how to support other humans than we were before that investment. All that research, all that evidence into neurochemicals, into understanding how our brain works on a physiological level is not actually helping us cultivate a more wellness-oriented perspective of the mind. Now, you may be hearing this and saying, Thaís, are you against science? No. I grew up with a astrophysicist. I grew up with a biochemist. I grew up immersed in science. I have so much respect for science. But I think we're missing something when we're looking at the human experience and trying to understand it through chemicals. So, if we are to take the medical model's perspective on mental health and their definition of the way in which we look at mental health as a physiological problem, then ideally everything would be solved through medication. There is a huge push, particularly in the US, to think of medication as the cure-all. If you have a mental health illness, you go to a psychiatrist or your primary care physician, and they will assign you an SSRI, an antidepressant, some type of medication, and then you feel better. That's kind of the umbrella in which we see mental health. When talk therapy is prescribed, it's usually prescribed short term. Oh, you have anxiety, 12 sessions with a therapist should do the trick. And as our health insurance is only going to cover those 12 sessions. The problem with this whole system, right, is that then we go to our health insurance. Before I get to the problem, we go to our health insurance. They assign us a therapist. They give us a limited amount of sessions, 12. By 12 sessions, you should be able to have your anxiety under control and everything should be fine. The problem is that we have to think about care. What is adequate care? Is 12 sessions enough to alleviate someone's symptoms of anxiety? The thing is, health insurance companies use research that are very limited in scope and usually aren't very conclusive, but is written in such a way that confounds what's happening. They use that research to support why limited, minimal care is sufficient. I'm here to argue in this episode and in this series that we need to reevaluate and really rethink how we view care, how we view our ability to get support. And it's important for you as the consumer to know the world that you are grappling with when you're trying to seek care. I am not an anomaly here. I'm not offering something that's unique to me. I wish I was that special, but there are actually hundreds, if not thousands, of practitioners in the mental health space who advocate the same thing I'm advocating. And so much of what I'm going to share here is just their own language, is their own views that I deeply agree with. There has to be another way. And I'm inviting us to think of what is that other way that we can get the help and support that we need without the pressures from health insurance, from psychiatry, telling us that the solution is short term, is simple, is solvable, boom, boom, done. You have anxiety, here are the symptoms, here are some workbooks that you can do, you take your medication, you're good to go. What if it was so much more complicated than that? And that complication isn't a bad thing, but actually the entry in which we can understand ourselves and our worlds in a much deeper, richer way. Yes? Am I starting to build a case here? Okay. So let's dive a little bit into the different professions of mental health, and then I'm kind of loop it all back around into the medical model and do a little bit more conversation about that. And then we're going to talk about the different types of support that you can get. And then we're going to wrap up this episode. Okay. So there are different professions in the world of mental health. First, let's start with a drug abuse counselor. A lot of drug abuse counseling programs don't require the counselor to have a master's. Usually they have a bachelor's and then they have some additional certifications. And drug abuse counselors predominantly work within drug abuse spaces, inpatient, outpatient treatment centers to support people navigate their addiction. Yes? Okay. Then we have psychologists. Now, psychologists holds a doctoral degree. So they have a PhD or a PsyD. PhDs are a type of doctorate program where you focus your efforts on studying and doing research. Versus PsyD, the program tends to be more oriented towards helping psychologists get clinical experience. This is a big deal. There are psychologists who go to school, get doctorates in psychology, get their PhD in psychology, and have never sat in front of a human and listened to their pain. So psychologists don't necessarily have clinical experience. They may have a lot of education in a certain type of theory and a certain type of knowledge, but that doesn't necessarily mean that they do clinical work. And that's important for us to think about. Just because someone says psychology on their Instagram profile, for example, doesn't mean they actually have sat in front of someone or knows how to hold someone's experience or pain. That's not to say that they're not not qualified. It's just the type of education that they received. This is different than psychologists who get their PsyD. Their PsyD, it doesn't sound as sexy, but it actually is the degree that gives them the most knowledge of clinical psychology. So if you're looking for a potential clinician to support you in your mental health, if you're seeking a professional and you see that they have a PhD or a PsyD, it may be interesting to see what exactly it is that they studied. Most the rules, at least for LMFTs, and I'm pretty sure this extends to psychologists, is that they can't use their PhD if their PhD is in a different specialty. For example, let's say they got a PhD in philosophy. They can't use that as a way to make it sound like they have more knowledge of psychology than they do. So that type of what is the word that I'm looking for? Ethical and legal bounds are so that psychologists and others in the field are marketing themselves appropriately. Now, psychologists, particularly those that have PsyDs, maybe in private practice, they may hold groups, they do individual therapy, etc., and they also do testing. Psychological testings are generally within the scope of psychologists more so than in the scope of an LMFT. If you want to get like a learning disability tested, or if you want to do some fun, complicated personality tests, you are most likely going to have to go to a psychologist to get that done. They can also diagnose, and they are usually, if they did a PsyD, they had to get quite a few number of hours in order to get their doctorate. Okay, so the psychologists are in many ways compared to psychiatrists. And people often get them confused. But their paths are very, very different. Because psychologists, and I'm going to be speaking here about psychologists who do clinical work, because that's the world that we're talking about, right? We're talking about talk therapy. Psychologists who do clinical work and do talk therapy, they typically got their bachelor's, and then they went into their master's and doctorate programs. Sometimes those programs are intertwined. Sometimes they did them separately, etc. Psychiatrists are part of the medical model. So they go through and become a psychiatrist by going to medical school. And they've had to do rotations. They had to work at the ER. They had to do the whole shebang-a-bang. in order to then become psychiatrists. And so when you go to see a psychiatrist, their focus is on the physiological symptoms of your mental health. They're there predominantly to diagnose, prescribe, and monitor medications. Most psychiatrists spend very little time actually providing therapy, and most psychiatrists, not all, have very little experience in actually doing talk therapy. Medical school does not really prepare psychiatrists to do talk therapy. So if a psychiatrist is doing talk therapy, usually they have additional training. Yes? Okay. So you generally go to a psychiatrist just to get prescription. And so know that that's important going in. If you're not sure what's going on with you, if you're going into a psychiatrist's office, most likely they're going to be looking for symptoms that they can diagnose and then they can treat psychotropically. Psychotropic is medication for mental health. If you are weary of medication, then maybe going first to a psychiatrist may not be the right call. You may want to go to a clinician, a talk therapist first and see then if it feels important to then go to a psychiatrist and get on psychotropic medication. You're not going to hear on my series any strong opinion about for or against psychotropic medication. In my experience, first off, it's outside of my scope. As a associate marriage and family therapist, it is outside of my scope to recommend any sort of medication. All we can do is offer we can hold space for you to explore it, and then we can refer you to go and talk to a psychiatrist. That's important to know, that our scope is very well guarded in order to protect the consumer. Having said that, I know plenty of mental health professionals who do have opinions about psychotropic medication. They either think that it's all quack or they think that everyone should be on it. I'm of strong belief that it is really up to the individual, and each individual will find what works with him and her or they. It's really, really important for us to have the knowledge and the wherewithal to figure out what works for us. And sometimes that's hard to do, especially if we don't know this world, we don't know the field. Some people, psychotropic medication is the most important thing for them. And that is wonderful. And then for some people, they try it and it just doesn't work. And they hate it and they end up getting off of it. And that works for them. We each have to find what works for us. There is a place for psychotropic medication. It's not, though. The hard thing is, it's not the cure-all. That can be hard to grapple because, again, I think so much of our culture implies this idea that mental health is a quick fix. You just take the meds and then you're good to go and you'll be done. And my strong stance doesn't have to do whether or not you should take psychotropic. That's not on me. My strong stance is if you are on psychotropic medication, it may be really, really also beneficial to be in talk therapy. And then, of course, we get into a conversation about access. And then, of course, we get into a conversation about how many shitty mental health clinicians there are out there. And we're going to talk about all of that. That is legitimate. But I still believe that if we're going to take something for our symptoms, for anxiety, depression, etc., then we should also be in talk therapy. We should be talking about it, thinking about it, figuring it out with somebody. Doing it alone can be really scary, and we don't know if it's working, and we don't know what's happening. And seeing our primary care physician or our psychiatrist once every 3 months may not be enough support. And I wish that we lived in a world where more people were referred to talk therapy, and that talk therapy was seen as like a long-term supportive system rather than this kind of short-term 12-week, 12-session expectation of being cured. This whole way of looking at mental health makes me really yucky. And again, we'll talk about all of that. Can you see how much I'm biased here? I told you this is not going to be a bias-free place. Okay. All right, so I talked about psychologists and I talked about psychiatrists, okay? Those are the two kind of top guns. And their licensing board is two completely different organizations. psychologists are licensed by licensing boards in 8 states. Yes. However, the American Psychological Association and the American Psychiatric Association are two kind of big umbrellas that help maintain the field and help understand the world of mental health. What's interesting is that the book that all clinicians are trained by and are taught to understand and to read, and it's the book of diagnosis, is the DSM. Have you heard of the DSM? So the DSM, or the Diagnostic and Statistical Manual of Mental Disorders, is right now in its 5th edition, which is wild. And it's a diagnostic tool. It basically gives you hundreds of mental health disorders and then the symptoms of the mental health disorders. And it teaches you how to code it and how to treat it. The theory, again, very medical model, is that if you can get a diagnosis, then you can create a treatment plan around that diagnosis. That's not to say that it's not how it works. It's just to say that that's how typically the DSM is viewed. It's viewed as the Bible of mental health. And if you can get a diagnosis and you can get a treatment plan, then you can fix this mental health issue. The DSM falls within the realm of the American Psychiatric Association. Isn't that fascinating? It's the American Psychiatric Association, which we just talked about. Psychologists view mental health from a physiological standpoint. Yes, the American Psychiatric Association is the one responsible for creating the DSM. That should tell you so much about how America and probably the world at large views mental health. Yes? Okay. So we talked about drug abuse counselors. They often work in the realm of addiction. Then we talked about psychologists. We talked about the 2 different types of psychologists. You have your clinical psychologists, you have your research psychologists. Again, if you see psychologists, that doesn't necessarily mean that they have 1 iota of clinical experience. Discernment here is key. Then you have psychiatrists. We've also talked about how psychologists can do psych testing, as well as clinical psychologists can do talk therapy, they can diagnose, they can do all of those things. Okay. We talked about how psychiatrists operate within the medical model and they tend to prescribe medication, though of course there are exceptions. There are psychiatrists who are also trained in talk therapy, and there are plenty of psychiatrists out there that refer to talk therapy. Love those psychiatrists. Now, we have counselors, clinicians, and therapists, psychotherapists, clinicians, counselors. This category of professions generally only require a master's degree in a mental health related field, such as psychology or counseling psychology, marriage or family therapy, among others, depending on your state. Because, like I said before, the licensure it varies per state. This is my degree. I got a master's in clinical psychology. I'm training to become a licensed psychotherapist. We can diagnose and treat a variety of mental health disorders. We can only do testing if it falls within the work that we're doing in the treatment. For example, if I get a random referral from someone wanting me to do some sort of testing on them, I wouldn't be able to do it. I'd refer them to a psychologist. But if I've been seeing someone for 3 months and they asked me to do a specific style of testing, I could do it if I also have training on that testing. Okay, we're here to provide talk therapy. That is our entire profession. That is what we are learned and trained to do. And if you're interested in becoming a therapist, I'm going to do a whole episode for practitioners who are interested in entering the world of mental health and my own experience of that. Now, you'll also hear a lot about LPC, which are licensed professional counselors. There's LMFT, which are licensed marriage and family therapists. But then you may have heard of LCSW, which is licensed clinical social worker. In some states, social working masters and clinical psychology masters are very different. And in some states, they're very, very similar. clinical social workers are also trained to evaluate a person's mental health. They're also trained to do talk therapy, but they tend to have additional training in case management and advocacy services. So the general idea around clinical social workers is that social workers tend to be in more community-based organizations, helping with case management, helping with advocacy. For example, working at a community agency that supports giving resources to homeless individuals. But that's not to say that clinical social workers can't do talk therapy or that they're not just as equally qualified to do talk therapy. And I know plenty of clinical social workers who don't really do case management, and they have their own private practice and they do talk therapy. So it's a little bit of a weird division, and I'm not very well versed in the difference in specific classes that they do versus an LMFT. So that's a little bit outside of my knowledge. But if you're interested in going into clinical social work or going into getting a license to become a therapist, we'll talk about that in a final part of the series. Okay? All right. So let's see. What else? Who else is in the field? Those are the big dogs that are in the field. The big dogs. The big categories. We also, of course, have in the world of psychiatric support, we have general practitioners, primary care physicians who also can prescribe medication. Primary care physicians are responsible for knowing a heck of a lot of every facet of the body, but you may want to consider visiting someone who actually specializes in mental health care. I know there's a lot of pressure put on primary care physicians to have quick fixes. So if you go in and you say that you're depressed, I've done this before with a primary care physician a long time ago. I said I had some trouble sleeping, and they wanted to prescribe me some sleeping aids, some sleeping medication. And that may have been fine, or maybe I would have wanted to talk to someone who actually specialized in mental health care, and they may have been able to help me more. So if you don't feel good, if you're feeling depressed, if you're feeling anxious, if you're not feeling good, if you're, spiraling, if you're having trouble getting up, if waking up, if you're lethargic, if you're having a really hard time concentrating, go talk to somebody. It doesn't matter who the fuck you talk to. Go talk to somebody. Anybody is better than nobody. You don't have to carry this alone. However, just know that your primary care physician is quite limited in scope. And what they may do is they may refer you to a talk therapist, they may refer you to a psychiatrist, or they may prescribe you medication. I think the best thing to do if you're not feeling good is to talk to somebody and get the ball rolling, because the process that it takes to get the right support can take a little bit of time. And I don't know if that's a bad thing. I don't know if that's a good thing, but it kind of just is the way it is. It's going to take some time to get the right support for you. And so it's better to start now. Don't be daunted by the task. You don't know how hard or how easy it's going to be. It's just going to take a little bit of time to figure it out, because even if you just take antidepressants, antidepressants take time for it to work. It's not an overnight thing. It's just going to take time. So set that as an expectation and then go talk to someone, okay? You don't have to carry all of this alone. All right. You also have like family nurse practitioners. You have psychiatric pharmacists. You have, those are kind of like the big ones in the field of who you may kind of be able to support you in your psychiatric care. But I think I covered all of the big categories. Of course, there's an additional category that I don't think a lot of people talk about, which is life coaches. Most life coaches don't feel like they fall in the realm of mental health, but again, why not? Who defines what mental health is or is not? Is mental health simply the diagnosis of mental health illness? Is mental health simply seen in the medical model, or is mental health an existential question about the human suffering and human existence and what we're here to do? In that case, coaches often support people manage their anxiety, get clarity on their jobs, right? Like get clarity. Like I do emotional wounding work. That very much falls within human suffering. So in my mind, these are all in the world of mental health. Let's see what else. And then you have, of course, pastors who tend to counsel and listen to people. You may have come across that if you're a part of a church. But I think these are the big ones. Let me make sure that I'm not missing anything. Oh, right. One thing that's important to know is that the word therapist is not protected by law. And that's why you can use the word therapist to define a lot of different things like physical therapist, massage therapist, art therapist, music therapist, yoga therapist, right? There's a lot of different ways that the word therapist can be used. It doesn't really have to do with what a psychotherapist does, which is, to listen and understand and provide support for your needs, your mental health needs. So the word therapist isn't protected by law, but the word psychotherapist is. The word marriage and family therapist is protected by law, and it's very important in that protection of the law how we are marketed. And so psychotherapists and therapists are often used interchangeably, but it's helpful to know that if somebody says psychotherapy or psychotherapist, they are legally bound to make their marketing super clear. And that may be helpful for you in your search for someone that can support you. Usually life coaches don't have a lot of training in learning how to hold space for others. A lot of life coaches come into the field through their own experience, and that's something wonderful in and of itself. But that's also important to keep in mind. Not all life coaches, of course. I am an exception. I am a life coach, and I am trained to listen to people in my profession as a associate psychotherapist, but not all life coaches. And so it may be helpful to think about the difference between a certification versus a license. Anyone can get a certification because anyone can claim that they offer certifications. Certifications aren't usually protected. They aren't usually restricted or defined. I could create a certification class tomorrow and offer certificates to people. So they don't have quite as much power. Not to say that they're not valid or not to say that they're not meaningless. Can't equate that at all. However, certificates are less bound by any legal and ethical codes of conduct versus a licensing board. My licensing board is the Board of Behavioral Sciences in the state of California. I had to pass a law and ethics exam as part of my licensing process that made me sure that I knew the laws and the ethics that protects my industry. It protects my industry not from the outside, but protects the industry from itself. It's a way to protect consumers. The licensing board is not really there to help me. It's to help the consumer not get fraudulent support. And so the Board of Behavioral Sciences wants to make sure that we're marketing ourselves, that we're taking care of our licensing in such a way that we're being responsible to consumers. Now, I have lots of issues with the Board of Behavioral Sciences. I think that there's a lot of things lacking. I think the proliferation of life coaching is partly a consequence of the BBS not adapting to current times, but that's a separate conversation for another time. But I just wanted to make sure I differentiated between a license and certificate because that may get confusing for you. And license means that while that person is holding that license, they have to hold ethical and legal standards. Whereas a certification, you do not. It means that you completed a program, you completed a training, you completed a thing, but you're no longer bound to that thing once you have that certification. Okay, let's enter the final stretch of this episode. We're already going into a lengthy episode here. I have obviously a lot to say, but I want to talk about the different types of support that you can get. One of them is talk therapy, which is, individualized one-on-one support. But there are other types of support. There are other types of ways that we can get mental health support. Inpatient treatment centers or hospitalizations are an option. There is something called a 5150 hold here in the state of California, which means that the police can hold an individual in a hospital for 72 hours if they have reasons to suspect mental health destabilization. Inpatient treatment centers simply mean that you live there and you stay there for a duration of time. I'm thinking about 28 Days Later. I think that was the name of the movie with Sandra Bullock, where she went to a 28-day treatment center. That's an inpatient center. You stay there, you live there. And those can be so, so, so important and helpful for those who are grappling with addiction. Because oftentimes we can't fight an addiction in the same environment that caused the addiction. Right? So separating ourselves, going into a treatment center may be really beneficial. Eating disorders is another place that often offers inpatient services. Again, because those who are experiencing an eating disorder and they've lost so much weight that they are at the verge of organ collapse may need the type of supervision that's not available if they're not in a facility. So that's inpatient support. I wish these were a little bit more normalized, because I think that there's something so powerful about having a retreat from the chaos of the world and really focusing on something that's really breaking within yourself, like an addiction or eating disorder. Of course, these tend to be expensive. They tend to be inaccessible. Again, whole other thing. Then we're talking about inpatient, outpatient treatment centers. These are the treatment centers that do both inpatient. Some people stay, but some people live at home and they go to the treatment center for 8 hours a day or what have you. So they have a little bit more freedom to go in and out, but they are expected to abide by a program that the treatment center has set out for them. That's what they mean when they're talking about inpatient, outpatient treatment center. Then you have group therapy. Group therapy is wonderful. It's so I feel like it's not talked about as often, but it is a wonderful place to learn how to navigate social anxieties, interpersonal dynamic, interpersonal challenges, because it is all going to get evoked in group therapy. And if you have a really good facilitator, you'll be able to really grapple with these social challenges, interpersonal challenges in a way that is right there in front of you with these people, these 8 people around you, guiding you to think about yourself and the relationship differently. It's such a cool experience. I highly recommend group therapy, and a little bit of a teaser, but I am going to create my own group therapy program in 2022. Stay tuned. Shh, don't tell anyone. So there's group therapy, there's individual therapy, that one-on-one that we talked about, right? Then we have, what other types of support do we have? We have medication. We talked about that. Psychotropic medication for our mental health, for our brain chemistry. We have something called brain stimulation. Have you heard of brain stimulation? So brain stimulation therapies involves activating or inhibiting the brain directly with electricity. And it's a really interesting type of support that can be useful for people who really struggle with chronic debilitating depression. I don't know much about it. You can search for it if that's of interest to you. But brain stimulation and microdosing. Microdosing definitely falls outside of the range of what we're talking about here, but there has been some pretty interesting, hopeful research about microdosing and the potency of microdosing for veterans with PTSD, et cetera, et cetera. If you're more interested in microdosing, obviously you can Google that. And then we have things like animal therapy, equine therapy, drama therapy. All of these can play a really critical role in helping us navigate our mental health challenges. The wild thing about support, right? The wild thing about mental health is that we are each different and are going to require different things at different times. There is no one size fits all. And this is infuriating for science, because science requires constancy in order to see what helps and what doesn't help. And what's a real struggle, but a really cool thing, is that the belief that something will work is the most potent force that will make that thing work. You have to believe that it is useful and that it is going to work in order for it to work. Isn't that the wild? That is so wild. In order for you to get the type of support that you crave, you have to believe that that type of support is out there. But that can be really, really hard when we've experienced hopelessness or when nothing has worked in the past. Hope is a really wild thing. It can be very tenacious at times, and it can be very fleeting at others. And it's hard to grapple with how to hold hope in a way that feels supportive for us instead of debilitating. But here's the thing. If you're seeking support, there is support out there for you. It is out there. It just may not come at the first glance. I know a lot of people who really struggled to find the right person, and then they found them and they realized why it just didn't work with anybody else. Because there is something to be said about the right fit. Not everyone is going to like group therapy, for example, but for the people who like it, it's the most profound, life-changing experience of a lifetime. So part of our journey, this series that I'm offering you all on mental health, is to guide you to understand what may be most nourishing for you and to then provide you the bravery, the courage it takes to seek it out. Your needs are important, your desires are important, and you don't have to do this alone. I had Amanda White on the podcast talk about mental health and social media, and I think what we're really grappling with right now is that a lot of things feel like we should just be able to do ourselves. We should just be able to tackle this shit ourselves. We don't need anybody. Needing people is a sign of weakness. Depending on others is a really terrifying thing. But here's the thing. No amount of social media, no amount of texting on an app can possibly replace the potency of having someone listen to you and care about you and help guide you into your innermost experiences. Therapy is to help you understand the conflicts that are here within you, that you're grappling with. Therapy is meant to help you make sense of life. Therapy is meant to help you find a way to live your life that feels full and nourishing for you. Therapy is so much more complex than just a series of diagnoses, symptoms, and treatment. And I think we miss that magic when we're so focused on this medical model of looking at mental health. So what I'm going to offer in the next few episodes, I want to talk about the history of talk therapy. I want to talk about the different approaches of talk therapy, because talk therapy in and of itself is a huge, beautiful, complicated spectrum of support. And then we're going to talk about going to therapy, how to find the right therapist, how to know if you need therapy, what to expect in the first session, how to make sure it's the right fit. I'm also, the reason why I keep saying there may be 4 or 5 episodes, I'm debating whether I want to do a whole episode on the most popular words in the world of mental health and define them and explain them in my point of view. But then I'm definitely going to have an episode, the final episode of are you considering going into the field? Let me share with you what I've learned. I've gotten hundreds of messages on Instagram of people, well, maybe not hundreds, but many messages from people on Instagram asking me about my experience because they want to figure out if this is the right next step for them. And I want to offer and disclose that and share with you my process of deciding how to go into the world of mental health. Now, like I said at the beginning, this is a biased series. I'm not impartial. I am a participant in this field. I am passionate about this field. I see the magic in this field. I know the efficacy of talk therapy. I know I've seen it. I've experienced it. And I want to imbue you with some of that potency and magic, because I believe you deserve getting support. And I think that support is more accessible than you may think it is. It's more available than you may think it is. And then, of course, talking about accessibility and the limitations of our society is important too. And we're going to get into all of that. So thanks for hanging in there with me. I hope this has been supportive for you. I'm looking forward to hearing your thoughts. You can tag me on Instagram. I am Thaís. Message me. I love hearing from all of you. And welcome to Mental Health Awareness Month. I look forward to talking to you next week with part 2.